So this is the proper position that we are looking for, always as a start. Keep him comfortable, and then we decide about the exposure. We don't recommend like early exposure at our patients for the cultural issue, as you know, and the background here, especially if she's a female. So only expose what you need as you go through. And as we start the exam, we don't need a lot of exposure, because actually we will just start by general exam. So I'm not going to expose my patient at this moment. Always you have to make sure that your environment that you are using for the exam is very comfortable. You have good light, the temperature of the room should be very suitable, especially if you are going to expose the patient and keep him off clothes, because if the room is too cold, the patient will not like it. So good light, good environment, and in addition always you have to keep privacy. If you are in a place where you can use curtain or a room, private room, then you have to close it. So the privacy, keeping privacy with the patient is very important, because again your patient will be more confident with you if he's in a private place. For sure he will not like it if a lot of people are looking at him from here and there. So privacy is very important to keep at this moment. Now, once you prepare the patient well, then you start the general appearance. The general appearance of respiratory system and the points that are there are a lot. However, there are certain important issues that you have to make sure that you are covering. The first thing, even before you touch the patient, general appearance is just the appearance of the patient without a lot of touch, and even no touch. So the first thing that you will do is you will be looking at your patient. Is he sick looking? Is he normal looking? Is he in pain? These are the first look that will start with the patient, is how he does appear. And then you look at the body build of the patient. The body build, simple body build. You don't have to be complicated. Whether your patient is obese or wasted, underweight, these are normal body build. And then you look at connections and respiratory distress, signs for respiratory distress. I will give you more about this as we go through. The first slide that we see here now is about sick or ill or normal, but just by looking at the patient. And this is common sense, just common sense, looking at your patient. Is he sick looking? Is he in normal, usual way, or is he in pain? So this is the first thing. The second thing is the body build, which is either normal, obese, or patient is thin. We don't have to comment on the weight, because we did not yet use weight measurements at this stage. And then we go next to the connections, whether your patient is connected to any medical kind of connections that we will go through now together. The first thing you look for respiratory system is whether your patient is connected to oxygen. And if he's connected to oxygen, then you have to actually give more details about oxygen connections, whether he's connected to oxygen by nasal bronchs, as you see it in the slide there. Nasal bronchs is there, and I can point to that as you see it there in the slide. And we have other actually ways of oxygen therapy that we use commonly in the hospital, which is by mask, as you see also that in the slide. And this mask can be simple mask, can be mask with a reservoir, can be Venturi mask, and all these are important to look at. And you should know such oxygen therapy measures that we use, so that you can comment. It is not enough to say the patient is on oxygen. It is important to say my patient is on oxygen through nasal bronchs, and even important to mention the rate, 2 liters per minute, 3 liters per minute. And if he's connected to the mask, then you specify which type of mask that you are looking at. The other connections other than the oxygen, important connection also we use in the hospital is the cardiac ECG monitor. And the ECG monitor is clear. You can see like a type of monitor that you see it in the slide there. And you can just look carefully for the monitor. You will see leads that are connected to the patients to record the cardiac ECG tracing. And these leads will be connected to a monitor that will show up the ECG pattern of the patient. Important connections are the IV connections. And there are different IV connections that we use in the hospital, which again, it is very important to mention them, the name, the type, and as you go on through the course, you will see these connections and you will be able to recognize them. I will go with them now in the slides. The first one is the slide that you see there, which is the IV cannula, which is just a simple cannula that will be actually inserted in one of the peripheral veins usually. And the cannula can be connected to an IV set or can be in place. Some patients will have just IV cannula without connections to IV set, and others they will have an IV set as you see it in the slide there. The IV set will be hung up beside the patient and it will be relaxed. It will be actually connected to the cannula, and it can be simple IV set or can be like IV infusion pump, can be IV syringe pump. These are shown all in the slides. The first one is the infusion pump. This is the syringe pump, which you can also notice that is connected to the patient. This type is called syringe pump. There are other connections also that you have to be careful when you see your patient connected to, which is a central line. Some patients may not have the peripheral line connected. They may have a central line going to one of the major central veins. There are different veins that we use in the hospital to connect our patients to. One of them is the common one, is the subclavian vein. There is the internal jugular vein, and we use also the femoral veins in some occasions. So these IV connections which are central are important to point at, and you should look carefully whether your patient has central line or peripheral line, because actually the status of the patient can be important to look at depending on the line. So because usually if the patient is connected to a central line, usually these patients are more sick and they need more better care, so you have to keep more careful eye on them. So the type of the line that you see connected to the patient can also give you like an idea about patient status.